Today's topic is something as common as it is excruciating. If you ever had a kidney stone, you will know that pain is really unbearable.
I'm a urologist. I've been practicing urology for the last 30 years.
Sometimes they can damage your kidneys. Beer helps flush out stones.
Again, by the time you see blood in the urine, the stone is already formed and probably moving also. You should not feel thirsty. You should drink water before you feel thirsty.
You should be watching your urine if it is getting very dark color or high color. Definitely that is
Any stone which is beyond 6 mm,
6 mm.
the chances are very less. The chances of open surgery is extremely low.
What will happen if the stone is left untreated? Namaste everyone. Welcome to yet another episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a platform where we try to simplify complex topic with the help of experts. Today's topic is something as common as it is excruciating. Kidney stones. If you ever had a kidney stone, you will know that pain is really unbearable. But kidney stones are not just about the pain. Sometimes they can signal some internal health problem. Sometimes they can damage your kidneys. And many a times they are totally preventable. I am very happy I am joined by Dr. Manohar, who is an experienced and leading urologist, has treated thousands of kidney stones patients. He is going to tell us what are the common reasons for kidney stone, how do we treat kidney stone, how do we prevent kidney stones. Dr. Manohar, thank you for accepting the invitation to be on the podcast. Dr. Manohar, can you tell us something about your background?
Thank you, Dr. Amitabh, for inviting me to share my thoughts and my philosophy regarding management of kidney stones. Management includes not only treatment, it also includes prevention of kidney stone formation. I am Dr. Manohar Mamani. I am a urologist. I have been practicing urology for the last 30 years. And like Dr. Amitabh rightly said, I have treated a number of patients with kidney stones. And treating kidney stones is one of my passions. I also, apart from treating kidney stones, I also deal with pediatric urology, urological problems in women, cancers of the urinary tract, prostate problems. But like I said, treating and taking care of patients with kidney stones is my passion.
Thank you, Dr. Manohar. We are very lucky to have you here. So let's start, Dr. Manohar. Start with simple. What exactly are kidney stones?
Kidney stones are certain hard objects which are formed out of the minerals and salts which other would have been dissolved in the urine. Once the urine gets concentrated with these kind of substances, they crystallize and form stones.
So is this something which is like a normally present in the body or in the concentrated urine, or only when it becomes abnormally concentrated it can happen?
Yes. Now kidney stones are not normal. Most people, almost let's say about 70 to 80% of people don't form kidney stones in their lifetime. In their lifetime, whatever the kind of fluids they take or kind of diet they have. But then there are these 20-30% of people who form these stones. Usually, apart from the predisposing factors, they also have a little bit of genetic predisposition. These people form stones.
Yeah. So whenever we hear about kidney stone or someone had kidney stone, the first thing that comes to our mind is severe pain. So why kidney stones are so painful in most of the instances?
Most stones are formed in the kidney. Stones which are less than about, let's say, 2 to 3 millimeters, majority of the times may even pass without your knowledge. Now, the pain is caused by the block in the flow of urine.
Okay.
Kidney is connected to the bladder. Bladder is where the water is stored. Kidney is where the water is produced. Urine is produced. Is connected by a tube known as ureter. the kidney and the ureter are not distensible. Now, when there's a block to the flow of urine, especially when this kidney stone comes down the ureter, there is increased pressure in the system above, and then this causes, because of the stretching in the kidney substance and the ureter, causes pain.
So only when it is in ureter, you mean to say it causes pain?
Most stones in the kidney, inside the kidney, unless it is causing block to the flow, or if there is evidence of if there is infection, will be painless.
Okay.
Only when these stones come into the ureter and block the flow, one has pain. Let's say a stone of about 2 centimeter may remain silent inside the kidney for a long time, but a 6 stone in the ureter can be, like you mentioned, excruciating pain one can experience.
Okay, okay. So that's interesting. So if it is in kidney, it is not going to be that painful as against the
It can be painful, but unless there is a block to the flow, the pain is not the major concern there.
Yeah.
He usually presents, patients usually presents with a stone inside the kidney, not blocking the flow, will present probably because of infection
Correct.
rather than pain.
Correct, correct. So we do hear there are multiple varieties of kidney stones, various types of kidney stones. So what are those different types of kidney stones which you see in your practice?
Broadly, there are 4 types of stones. The commonest stone being the calcium stone. They form almost about 80% of the bulk of stones.
Okay.
And then we have stones formed out of, we call it the Stewart stone, or the uric acid stone, or the cystine stone. But the commonest stone is the calcium oxalate stone.
Yeah, and that is almost 80%.
80%.
And remaining 3-4 types are like less than
Uric acid forms about 10%, and rest of the 2 will form another 10%.
5 to 10%. Okay, okay. So what are the common reasons then? Like, is it related to diet or water intake or genetics? Why do they? How do they start?
The commonest reason for formation of kidney stones will be a genetic predisposition.
Okay.
In the sense, parents, if they had kidney stone, the children are more likely to have these kidney stones. That will be the commonest reason. The second would be, if somebody has had a stone earlier, he is likely to form a second stone.
Okay.
These 2 factors, along with certain factors like dehydration, going on for a long time, not having adequate fluids, working in hot environment, people who are doing into a lot of gymming and sweating a lot, and they sweat a lot. So these situations where the body gets dehydrated, and those substances which would have otherwise dissolved in the urine tend to crystallize and form stones.
Okay.
Apart from this, there are also situations like certain medical conditions like gout is one of the common causes of where one we see uric acid stones.
Yeah.
And other things like obesity or immobilization problems. Somebody who's got a paraplegia or a quadriplegia and immobile, those people are again prone for formation of stones.
So in your experience, it's more of a genetic predisposition that puts them at a higher risk, plus some additional triggers like dehydration or dietary irregularities.
By genetic predisposition is meant how the body handles the chemical like oxalates or uric acid or calcium.
Yeah.
Now that is genetically decided. But then if that doesn't necessarily mean if the father or mother had a stone, the child is going to have a stone.
Correct.
If this child is made aware that he is likely to form stones and changes his lifestyle, keeps himself well hydrated in his lifetime, if he makes these changes, he may not form a stone.
Yeah. Yeah.
Not all children who are born to people, parents who had stone will form stones.
That's very reassuring to know. So even if you are genetically at a risk for development of stone, with a proper diet
Yes.
and adequate hydration, you may be able to completely avoid formation of stone. In
Definitely.
future. Yeah.
Definitely.
Thank you for the information. Now we do see a lot of people who are at a higher risk as compared to their say relatives, brothers or siblings or colleagues or something. So, who are those people who are at a higher risk? Now, besides say genetic element, what are those group of people who are at a higher risk for development of stones in your
Yeah,
practice?
a good question. Now, people in certain areas, people who, let's say, people who stay in this part of the world, or
Correct.
people in, I am from India. There are people, certain areas in India are also identified as stone belts.
Correct.
Now, these people who stay in this part of the world or in those stone belt areas, have a higher chance of formation of stones. The other situations where they get predisposed to stone formation is, like I mentioned, dehydrated or not well hydrated, especially people who sweat a lot, workers who are working outside in the hot sun sweat a lot. So they tend to form stones. Obesity is considered one of the predisposing factors.
Oh, interesting.
And men are genetically, again, more prone to form stone than women.
Okay.
These days, we are also
Is there
seeing
any specific reason for male over female? Anything, or it is just the
it is just
genetic
an observation.
observation? Okay. Okay.
And lately, what we are seeing is even the chances of stone formation has increased in children. It was not so the case, let's say, about 10, 15 years ago.
Oh.
Now, these days, one of the child I have seen was 1 year and 3 months, had presented with a stone.
So maybe there are some changes in the habits that has happened in
Yes,
last 15 years.
definitely. Now, children, especially, nothing to body shame, but obesity has increased a lot amongst youngsters.
True, true.
And this predisposes to them. And what is the cause of this obesity is certain foods like fried food and colas,
Correct, correct, correct.
drinks
food,
which are junk food, and drinks which are rich in sugar.
True, true. So, yeah, thank you for clarifying all these things. Now, obesity, we have been discussing in our podcast. They can predispose to, say, heart disease, diabetes mellitus, metabolic syndrome, so many other diseases. So, additionally, even if it is putting them at a risk for kidney stone, definitely this is something for us to look into our habits, what we eat, how is our lifestyle. Definitely weight management has to be a part of
One other thing, sorry to interrupt, one other thing I would like to impress here is people who are starting to diet. There are certain diets which are making them
fancy diets,
more prone for stone formations. So anybody who comes to me saying that they would like to diet, I usually refer them to Dr. Amitabh for his opinion, to make sure that you don't end up in formation of stone. You are gaining something and you're losing something.
Correct.
So certain diets, before you start any kind of diet,
Yeah,
it's better to have a medical opinion.
Yeah. Thank you, Dr. Manohar. Frequently, water is blamed for formation of kidney stones. So, what is the role of water in formation of kidney stones?
Yeah, let me make it very simple. You take a glass of water, keep on adding salt to it, and keep stirring. To an extent, it will dissolve.
Correct.
And then, as you keep on adding salt, it stops dissolving.
Correct.
And it remains in the bottom. It crystallizes. It stays there.
Crystallizes.
That is exactly what happens in the body.
Yeah.
Now, these chemicals, minerals, or other substances which are responsible for stone formation, once they get concentrated, once the fluid in the body is rich with these substances, they crystallize.
Understood.
And conversely, it also helps one to know that if you keep on drinking more water, the material which was getting crystallized gets dissolved.
Correct.
So,
Correct.
having good amount of water helps prevention of stone.
So, this is again a very, very simple but very useful. Whatever is the reason for stone, whether it is genetic or whether it is metabolic or any other reason, but if you drink more
Enough
water, it's just going to dissolve. So, then how do we know how much water we should be drinking?
Dr. Amitabh, very good question. The quantity of water one needs depends on his age, his work environment, and whether he is working mostly indoors, outdoors, or both. And in general, for a good health, especially kidney health, one should drink about 3 liters of water per
3
day.
liters of water.
Now, when I say 3 liters, it doesn't mean 1.5 liter when you wake up and 1.5 liter before you sleep. No. It should be throughout the day.
throughout the day. It
A
should be
good
spaced out.
yes, a good calculation will be on an average a glass of water every 1 hour as long as you are awake.
Yeah.
Maintains good hydration.
Yeah. Yeah.
Other way of finding out whether you are hydrated well is the color of the urine. The urine should not be colored.
Correct.
If the urine is not colored, you are well hydrated.
Yes.
Now, especially people who stay in this part of the world, another way of knowing that you are well hydrated is you should not feel thirsty.
Correct.
You should drink water before you feel thirsty.
Yeah.
Body is telling you you are dehydrated when you feel thirsty.
Correct.
So you should not feel thirsty.
Yeah.
Yeah. Another way of finding, is to you should be passing urine on an average 2 to 2.5 hours. That means your kidneys are working well and you are hydrated well.
Correct. So again, this was a very simple and very crystal clear advice how much water you should be drinking, and you should be watching your urine. If it is getting very dark colored or high colored, definitely that means that your water intake is not adequate and you should be drinking more water. In addition, every 2 to 3 hours probably you should be visiting washroom. If you are not, then probably your water intake is not
Yes.
adequate and you should be up titrating it. Very good piece of advice. Dr. Manohar, this is about water. Now, we see sometimes high protein diet or keto diets, they are in news for various reason, whether it is weight loss or whatever reason, sugar control. So what is the role, whether someone who is on such a diet put them at a higher risk for development of kidney stones?
Definitely. Now, high protein is part of the keto diet.
Correct.
Now, keto diet, the main problem with keto diet is one tend to consume foods which are rich in what we call it as the purines. This leads to increase in the level of uric acid stones.
Correct.
Now, keto diet per se will not change the frequency or the incidence of calcium stones, but definitely people who are on keto diet will have a very high chances of forming uric acid stones. But once there is a uric acid stone, let's say uric acid has crystallized, calcium also gets deposited on that.
Okay.
So they form mixed stones. The keto diet may make you prone for uric acid stones. If you are not on a keto diet and you formed a uric acid stone of about 2 or 3 millimeter, you would have passed it. But then people who are prone for stone formation, people who have a genetic predisposition, people who are consuming a lot of sugar and salt, if they tend to go on a keto diet, the chances of stone, not only of uric acid, also calcium stone increases.
So calcium and uric acid combined stone
Mixed kind of
combo
stones are
package, something like that.
Yes.
For stone,
Yes.
is they are at a higher risk. So then, what are the early symptoms they should be watching for someone who may develop, say, stone in future, in next few months, few weeks? So what are the symptoms they should be looking for, so that it can be picked up early? Is it possible, if at all? Yeah.
It is. Now, like we discussed earlier, people who are prone for stone formation, let's say there is a gender predisposition, parents had stone, it is advisable for the children to be careful.
Correct.
Yeah.
Correct.
Now, by careful is meant health checkup once in a while, let's say once a year, is definitely necessary to find out whether there is any presence of stone. So, people who are genetically predisposed or people who have had stones earlier have a very high chance of formation of stone. It is said that almost a person who is formed the stone for the first time is likely to form a second stone in a 5 years time.
5 years time.
Almost 50% of people who have a first stone will form a second stone in the next 5 years.
Yeah.
It is also said that 80% of people have a high chance of formation of a second stone in their lifetime.
Okay.
So given a situation like this, one has to be careful if they have formed a stone earlier.
Yeah.
Now if we have to think about the symptoms with which they present, by the time he presents with the excruciating pain, the stone is already there and it's already causing block to the flow.
Correct.
Now, early signs which could help us suggest that there is a stone is a little discomfort in the flank. Flank is this area. Discomfort in the flank. Some could experience little difficulty in passing urine. There could be increase in the frequency of passing urine. There could be burning.
Yeah.
A very important sign will be change in the color. In spite of good hydration, if there is change in the color, like orange color or cola color or cloudy urine.
Correct.
Again, by the time you see blood in the urine, the stone is already formed and probably moving also.
Yeah.
So the discomfort in the flank region, difficulty in passing urine, or any problems with urination are the two early signs you need to look for.
Yeah. So thank you. These are the early signs even before the actual excruciating pain develops, like flank pain or change in the color of urine. You should be watching for. So someone who is at a say higher risk or who has a genetic predisposition, probably he should be watching for all these signs. Otherwise also. Then how do we diagnose a kidney stone? Most of the cases, like someone who comes with the abdominal pain or flank pain, how do we diagnose full and final the kidney stone?
By the time he's come to you, he's already in pain. So the first thing is to relieve his pain.
Correct.
Right?
Correct.
Now, how do we diagnose this pain? One is taking a good history, by which is meant we need to find out whether genetic predisposition is there or whether he's had stones earlier, and what are his symptoms. His symptoms, like we discussed earlier, the commonest symptom will be pain, and the pain can be so severe. I read an article which said when they conducted a survey about the severity of pain, two top causes of pain are one is the kidney stone pain and a gunshot injury.
Oh,
they top the list.
that's
So it can be so painful. So people who come with severe pain in the flank, and especially if the pain is going down from this region, this is the flank region, going down to the groin and in men to the testes, that is suggestive of a stone.
Okay.
Now these are apart from pain, the other symptoms would be like we discussed, difficulty in passing urine and blood in the urine.
Yeah.
And especially if one has fever, we need to suspect apart from stone, he could be having infection. So this is about the clinical signs and symptoms.
Yeah.
Now when it comes to confirmation of this,
Yeah.
we do what is known as investigations. Investigation, the commonest investigation will be a urine test, a routine urine test, a spot test what we call, will show evidence of blood. Even if one does not see blood, when we do this test, there is evidence of blood. That will make us aware that there is a possibility of stone.
Yeah.
And the cause of pain could be a stone.
Yeah.
Sorry. Apart from urine test, we need to do a blood test known as CBC, complete blood count, where this is mainly done to see if there is any infection. Now, total count is the count of the white blood cells in the blood. If they are high, it will prompt us that there is a possibility that there could be infection. Now, when it comes to investigations for definitive diagnosis, it's called imaging. By imaging is meant an ultrasound or an X-ray or a CT scan. Ultrasound probably will be the first investigation to at least point out to an organ which is responsible for this pain. He's come, let's say he's come pain in the abdomen, upper abdomen on the right side. Now there could be other causes of pain. Let's say it could be a liver, it could be a gallbladder cause, or it could be just a intestinal cause. Now once we do an ultrasound, which is totally painless and harmless, it is a screening test. This will point us towards the possible organ which is responsible for this pain. Majority of the times, almost 70 to 80% of the time, it will give us information that there is a stone and what is the position of this stone.
So 80% of the cases you will be able to identify on ultrasound.
The source of this pain
Yeah.
and possible cause, and if it is a stone, where is the stone?
Correct. Correct.
But a definitive diagnosis will need a CT scan. Why CT scan is important? It will tell us the number, the site where the stone is located, the size of the stone.
Yeah.
Most importantly, if we do a CT scan with contrast, it will also tell us the functional status of the kidney.
Correct.
So before we decide on a particular form of treatment to be employed in this particular person who's come with pain, most situations needs a CT scan. And these days CT scan is available everywhere.
Yeah.
So CT scan is very important.
So CT scan is very important in ultrasound and CT scan in
Amongst,
in
if you
the
have a choice of one investigation, and if you clinically suspect stone is a strong possibility, CT scan is the first choice.
good old days we used to do X-ray. So what is the utility of X-ray in current era?
Yeah, okay. Now, very good question. Most stones are seen on X-ray. Let's say about 80% of stones are seen on X-ray. That also means 20% will not be seen. Why these stones will not be seen on X-ray? Is they could be overlying a bone.
Okay, okay,
They could be small.
yeah,
It could be covered by the gas. And if the calcium content of the stone is less, it may not be visible on X-ray. Now, X-ray becomes important for follow-up. Let's say this particular person has got a stone which is moving down the ureter, and he's got a 6 stone which is clearly seen on X-ray. And I decide, and he decides to wait for a while for spontaneous passage. So, in case we need to monitor, has the stone moved? So, instead of going for a CT scan once again, which of course your insurance is going to refuse, X-ray would give us information.
yeah,
Now, in case we see that the stone is moving down, it is an encouraging sign.
yeah,
We are more encouraged to wait for a little more while so that the stone passes away.
correct, correct. So that was my next question. In fact, when can a stone pass on its own?
Okay, very good question. Most stones, almost let's say 70% of stone pass by themselves.
70%.
70%.
That's a
But
very
these,
good news for.
yeah, but these are small stones. Let's
Yeah,
say they are
true.
2-3 millimeter stones.
Yeah, yeah.
Now, sometimes suddenly this person feels a little burning when he's passing urine. He sees a little burning, and then the stone pops out. Yeah, he's very lucky. Now, if we have to generalize, any stone which is less than 4 the chances of it passing spontaneously is close to 80%.
Oh, that's very good. Yeah.
Now, this is the next one will be a 4 to 6 stone is a borderline stone. Now, the chances of this stone passing out is about 60%.
Okay, okay.
Any stone which is beyond 6
6 mm.
the chances are very less.
Less.
Now, there are instances when people have passed about 8-9 stones also, but I will say he's been extremely lucky.
Yeah.
The chances of a 6 stone passing by itself is about 30 to 40%.
Yeah. So unless the stone is very small, less than 4 millimeter, then only there are chances that
Spontaneous
it
passage.
will pass out. So then in those people who do not pass their stone, who have a pain or are diagnosed with kidney stone, what are the other treatment options for those people?
Now, let's say a borderline stone, a 5 or 6 stone, and then the pain is not very severe. And if we can manage him with medications, if we can control okay, let me be very clear. Let me make a statement now. There is no medicine which is going to dissolve this stone.
Okay, that's a very important statement.
There is no medicine.
Almost all patients must be asking you.
Yeah.
And
Yeah, there is a lot of literature and wrong information on the internet that take this medicine, it dissolves. No.
Many herbal medicines also
Herbal
claim,
medicine.
yeah.
The chances, if one forms a stone, either he has to, the person has to pass it himself, or we need to go and get it out.
Okay, okay, got it.
Very rarely, uric acid stones can be dissolved, but the chances of it also dissolving is very low.
Very low. Okay.
So, how we manage this person with a borderline stone? Let's say 10 stone, no question of waiting. 4 stone, definitely wait. A borderline stone of 5 to 6 is the person whom we encourage to wait, and they also, if they are not very keen on getting rid of the stone, is to make sure he's well hydrated. With well hydration, with the flow of urine, and with gravity, the stone moves down.
Okay.
That is the first thing. Second, we need to control his pain. There are certain painkillers which we can normally call it as NSAIDs. Anti-inflammatory painkillers are given. But before we put them on medical management or MET, what we call it in MET is medical expulsion therapy.
Okay.
Before we put this person on medical expulsion therapy or medical management, we need to make sure he doesn't have infection.
He doesn't have
Infection.
infection. Okay, understood.
There are a few situations where we don't wait. What are these situations? One, a person who has a single functioning kidney. We cannot wait. Even if it's a 4 stone, we probably need to go in. A person who has a transplanted kidney.
Correct.
We need to go in and get it out.
Correct. Correct.
A person who has significantly sized stones in both the kidneys. So at least one side need to be cleared. Otherwise, in an unfortunate event, if he's come with a right-sided pain, that is because the stone is come down. The left side stone could also come.
Come down.
So at least one side should
That
be
will be
cleared.
an emergency. Both the stones
Definitely.
come down at same
It
time.
is an
Yeah,
emergency.
Yeah, true, true.
So there are certain situations where we can't wait. It doesn't depend how big or how small the stone
Correct,
is.
correct, correct. So then, which cases you do, like what are the various surgery, whether lithotripsy or laser surgery?
Yeah,
How do you
surgery.
decide?
Yeah, surgery broadly means to most people is cutting him open. Okay. Now these days, it's not done. Surgery for stone is extremely very rare.
Means cutting open and
Cutting
removing
open,
the
removing the
stone
stone
is extremely
is
rare.
not done
Yeah,
anymore.
I agree.
It is. It has to be a really complicated situation where other forms of treatment fail.
Okay.
Now there are minimally invasive or non-invasive surgeries procedures. Now the commonest question I am asked is, can we do laser? Yes, laser. Laser is a form of energy. We reach the stone. Laser can be done only when you reach the stone. There is no laser which can be done from outside.
Outside.
No.
Okay. Okay.
Now that treatment which is done from outside is known as a shock wave treatment or extracorporeal shock wave lithotripsy or broadly classed lithotripsy. These are electromagnetic waves which are centered on the center of the stone and made an attempt to break this stone into small pieces and they are going to pass it in urine.
Right.
This is known as lithotripsy or ESWL or extracorporeal shock wave lithotripsy. Laser is where we introduce instrument in the body. Bigger stones need direct access to the kidney. That is known as PCNL, percutaneous nephrolithotomy, where we go through the flank. This is where the kidney is located. A small hole is made on the body, and the endoscope is passed into the kidney, and then under vision with laser we fragment it.
Okay.
This is laser.
Yeah.
Now this is necessary for stones which are bigger.
Bigger.
PCNL is necessary for stones which are bigger. Let's say a stone which is about 2 to 2.5 centimeters, 3 centimeters. For records, the largest stone removed from the kidney is size of a coconut.
Oh.
That's the largest stone recorded. But most stones are about 2 to 3 centimeters and they need PCNL. Rest of the stones can be approached through the normal passage, of course under anesthesia. And we studied the road. We have a road map of his kidney, his ureter, bladder, and the urethra. Urethra is a terminal part of the urinary tract. Right. So we have a road map of that by doing a CT scan. And then we approach through the urine passage, get into the kidney or the ureter, wherever the stone is located.
Right.
And under vision, with laser, we can fragment the stone.
Yeah.
These are three common modalities of treating these stones in the modern days. Open surgery, like I said, if the stone is the size of coconut, no laser is going to help it.
Correct.
No. So these days, the chances of open surgery is extremely rare. And most stones can be either managed with laser or lithotripsy.
That was a very comprehensive discussion of all treatment options available for kidney stone. So, what will happen if the stone is left untreated? Is it going to damage the kidneys in future?
When the stone gets untreated, he is not aware of the stone. It's symptom. He doesn't have any symptoms. So obviously, the stone is staying there for a long time. As like we discussed earlier, as long as there is no infection or no obstruction to the flow of urine, this stone may remain asymptomatic. And when it remains asymptomatic, the chances of it growing, becoming big, the chances are very high. Now we have seen situations when the entire kidney is occupied by the stone. Unfortunately, this person didn't have any symptoms. Now when the kidney gets filled with stone, the chances of infection are very high. The chances of obstruction is very high. In a situations like this where we call it the staghorn stone, he probably will need an open surgery.
Correct.
And then your question was, will it damage? Okay, now if there is an asymptomatic stone, silent damage is a possibility. If one knows there is a stone and still neglects it, it's a wrong thing to do.
True.
No, somebody has told him to take this for 6 months and then it's going to disappear. It's not going to happen.
Correct.
It's not going to happen.
Correct.
It's only going to worsen by the fact that it is going to increase in size and the chance of infection are there.
Yeah.
Now these stones, if they unfortunately are stuck in the ureter, like the ureter is the tube which connects kidney to the bladder, they're stuck in the ureter, like we discussed earlier, the pressure above the level of stone increases. And that kidney and the ureter above is going to dilate.
Correct.
And because of the increased pressure in the system above, the kidney damage is bound to happen.
Correct. Correct.
So your next question probably is, how long do we wait? Yeah. A reasonable size stone, let's say about 4, 5, 6 mm stone, the pain is not less. We have confirmed there is no infection. It is reasonable to wait for about 2 to 3 weeks.
2 to 3 weeks. Okay.
Okay. Now beyond that, on further evaluation, we know that the stone is not moving. He's got frequent visits to the emergency. He's on painkillers for a long time.
True.
We have to go in and remove the stone.
True. Yeah. So if it is left untreated, it's going to damage the kidney. And as doctor clearly said that the stone has to come out, then only we can say that the stone is completely treated. What is your take on home remedies? Frequently we do see some home remedies for kidney stone, and many times these are circulated more on social media, probably by non-expert or not the expert in the field. So I'm not disregarding those, neither I am endorsing those, but what is your take on those home remedies for kidney stones?
If water is considered home remedy, I agree with you.
True.
Water is the only one, mostly water is the only one which is going to help.
Simple plain water, correct.
Now home remedies can be used in 2 situations. One is in acute pain, when he's come in acute pain.
Correct.
Second is long term, that is prevention. In both the situation, water is going to help.
Yeah.
The second home remedy which I would suggest is certain, of course, once in a while we eat excess amount of bad food. I mean, we are human. But then doesn't mean that we continue to do it more frequently. Especially people who are prone for stone formation should avoid excess salt.
Correct.
Should avoid excess sugar.
Yeah.
Should avoid drinks which are rich in sugars.
Correct.
Soda, which is rich in sugar, like I will not take any trade names, cola, that kind of drinks are not good. A common remedy which is employed in back home in India also is limbu soda.
Lemon juice. Correct.
Limbu soda or lemon juice, though it is a fizzy drink, it's a good drink.
Okay.
If you tell this, especially youngsters, if you tell him to drink 4 bottles of water, he's not going to like it. Give him a glass of juice. Give him a glass of orange juice. Give him a glass of lime juice. Give him a glass of soda.
That may help.
It will help. Yeah. It will help. As long as excess water is going in and he's adequately hydrated. If this is home remedy, definitely it will help.
So yeah, to some extent it will help, but ultimately anything other than plain water, I think it's like you just have to verify with your doctor first if you had stones and then consume. Now if someone already had a stone, it was treated successfully, I'm sure you mentioned earlier, but for our viewers understanding, what are the chances that the stone will come back in his body?
First time stone former, if he doesn't make corrections in his lifestyle, the chances of him forming a second stone in the next 5 years is 50%. If there are 100 people who formed a first time stone, if they do not take care adequately, will form a second stone in the next 5 years.
Okay.
The chance of recurrence is 50%. And in the lifetime, recurrence is said to be about 80%.
80%.
80%.
Okay. So you have to continue the good lifestyle or the suggestions advised lifelong to avoid this stone infection.
Most people, once they have this severe kind of pain, it's a wake-up call for them.
Correct. Correct.
But unfortunately, being human, they follow this, whatever advice is given, they follow it for about, let's say, 3 months, 6 months. And then gradually it falls back to the original. It should not happen.
Correct. Correct.
For the rest of your life, this particular unfortunate person who formed this stone should remember that he's likely to form a second
Stone in
stone
future.
and has to consume about 3 liters of water.
Correct. Correct.
Yeah.
Yeah. So he has to continue it lifelong.
This lifestyle changes of excess
Yeah.
water consumption,
Correct.
avoiding certain foods like chocolates and excess tea, coffee, sugar, salt
Correct.
should be avoided.
Yeah. Yeah.
That doesn't mean he should stop having chocolates. No.
Correct.
Once in a while is okay. We are human.
Yeah, he can still enjoy the life, but
Yes.
not at the cost of
Moderation is the key.
correct.
Moderation.
Moderation is the key. Yeah, that's a very good advice from today's discussion. Now, coming to the last question of today's podcast, what will be the one golden rule for not just stone bearer but otherwise healthy population uh, to prevent kidney stone in future?
Again, don't think I'm repeating, but it is so important that you keep yourself well hydrated.
Correct. Correct.
Good hydration, no dehydration.
Yeah.
That is the key thing.
So
Moderation is the key. Once in a while, it's okay to have a couple of chocolates or have a soda.
True.
That don't make it a habit to drink these kind of aerated drinks which are rich in sugar. I've had 3 or 4 patients. They were youngsters. They said, "No, we don't drink water." I was shocked. They don't drink water. They drink only soda.
oh,
Huh. There are people like that also. I mean, most of us are not like that.
Correct.
But then once you know you have formed a stone, or once you know that you are prone for stone formation, keeping yourself well hydrated is the key.
got it. Understood. Understood. So this is a very golden rule to avoid kidney stone in future. Stay well hydrated no matter what, whether you had stones or whether you never had stones. Keeping yourself well hydrated definitely is going to reduce the risk of stone formation in future. So yes,
Yeah. Hydrate, don't dehydrate is the key.
correct,
Moderation in everything.
correct.
If you don't want a second stone, don't have the first stone.
True, true. Yeah,
Prevention is the key.
key.
Especially when you know you are prone to it.
Correct, correct.
Don't get into it.
Yeah, yeah. Thank you very much, Dr. Manohar, for like clarifying all the doubts related to stones, answering everything that our viewers wanted to know. Now, that brings us to the next session of today's podcast, and this is sort of rapid fire questions wherein you will have to answer in one word or yes or no.
I will try. Yeah.
So, summer or winter, when do you see more kidney stones?
Summer.
Summer, okay, no surprise. Lemon juice, friend or enemy?
Friend.
Friend, thank you.
Without sugar, of course.
Without sugar, yes. Open surgery or laser, which one is better?
Definitely laser.
Laser, yeah, thank you. Which stone do you see more, calcium stones or uric acid stones?
Calcium stones.
Calcium stones, okay. Soda, guilty or not guilty?
Soda with sugar, guilty.
Okay.
Soda without sugar, friend.
Friend, okay, very good. That's also important piece of advice. Which stone gives you more trouble, small stone or big stone?
A big stone, and if we have to quantify small stone, if the stone is less than 3-4 mm,
Yeah.
it won't trouble much.
Okay, okay, got it. Drinking lots of milk will cause kidney stones, yes or no?
No.
No. Okay, thank you for clarifying. Now, this our youngsters are going to love this question. Beer helps flush out stones, yes or no?
No. Beer helps to hydrate. It is good for hydration only. Beer doesn't have any medicinal value for stone.
Correct.
In fact, a person who has beer over a period of time, he's regularly consuming beer, makes him more prone for stones because beer is rich in oxalates.
Ah, okay, okay. This is very important for our viewers to understand.
Whether beer or water, in acute situation of pain, hydration is necessary. So it serves the same purpose.
Yeah, yeah. So viewers, please remember, beer is not going to solve the solution. Yeah, maybe if you drink more beer, it is a form of a liquid. At a time, it may help, but not like everyday beer or something like
But
that.
I have had situations, doctor, I need to have a couple of beers every week. I tell them, if you're drinking a bottle of beer, drink a bottle of water. In that ratio, it is okay for somebody. Of course, you need to follow the guidelines regarding alcohol consumption. Those things are very important. Now, once in a while, if you are having a couple of beers and if you are prone for stone formation, the equation should be one bottle of beer, you should consume a bottle of water also. Regular beer consumption, to an extent, regular alcohol consumption, especially hard liquor and they say red wine also, can make you prone for stone formation.
So the last question, only men get kidney stones?
No, women also get kidney stones. Men are a little more prone, incidence wise, than women.
So thank you, Dr. Manohar, for answering all the questions in simple, clear language. So this brings us to the end of this very, very interesting, insightful discussion about kidney stone. Big thank you to Dr. Manohar for clarifying all the doubts related to kidney stones. Viewers, please understand, kidney stones are preventable, as Dr. Manohar clearly said. Adequate hydration, not getting dehydration is the key. You may come across various remedies on social media or internet. It is always wise to consult the expert in the field before experimenting any of those remedies. If you have any question related to today's discussion, we are very happy to answer those in the comments. If you want Dr. Manohar to discuss any topic related to his fields, please do write in the comments. Please do share this episode with someone who is suffering from kidney stone or who need to understand about kidney stone, who is at a higher risk for development of kidney stones in future. Remember, prevention is the key. Dr. Manohar clearly mentioned. Stay hydrated, take care of your kidneys. Thank you very much. Thank you, Dr. Manohar.
Thank you, Dr. Amitabh.
Thank you.